My name is Dr. Sharon. I'm the County Director Medical Services in Machakos County. I am married and I have a family with 2 sons, and I'm a wife and a mother and an auntie and also a friend. I'm a medical doctor. I hold a bachelor degree in medicine and surgery, and I also hold a master's degree in public health, which I acquired when I applied for the Australian Awards scholarship. I was awarded, and therefore I was sponsored to go to Australia to pursue master's degree in public health at the University of Melbourne, Australia for 2 years, from 2017 to 2019. After my completion and attaining of my master's degree, I came back to our country, Kenya, to Machakos County, which is the county that had released me to go pursue this master's. One of the privilege after being awarded the Australian Awards scholarship for my master's is belonging to the Kenya Australian Alumni Association, which I'm a member, and with that association we've been able to undertake many community engagement programs, just giving back to the community. And even one of the things that I benefited is being sponsored by the Australian Awards to undertake the Women in Leadership program that has really been key for me to be able to conduct my community engagement project, both at the county and even with the association, as well as I'm able to apply for grants whereby I'm sponsored to give back to the community. And when I came back, I was deployed as the Sub-County Medical Officer of Health. That means I was in charge of the Machakos Sub-County, and I was overseeing 13 facilities, that is health center and dispensary in healthcare delivery. After serving that position for about 6 months, I was deployed and appointed as the head of the Machakos Cancer Center and Research Care in the county, and that is where I was overseeing patient care, all patients with cancer in the county, and it was a project that had just been started. So actually I'm one of the pioneers and founders of that cancer center. I always say cancer is closer to my heart, and I'm very passionate in matters of offering quality cancer care to our people in Machakos. So I headed that position, and I always say cancer center is a baby to me, because I headed it, and we can say our county government, they were very happy for the projects that I had ensured that were in place. First, I ensure partner collaboration with the center and with the county. I ensured that we had registered all the patients, as well as I'm the first person who started a tumor board at Cancer Center, which is a platform whereby we discuss a patient to patient case by case, and we offer individual-based care. I also one of the person who initiated the development of the electronic medical records at Cancer Center. We also started a support group whereby all these patients who are affected by cancer at the Cancer Center, we meet with them on a monthly basis where we discuss about the disease, we discuss about their mental wellness, and even with the family in terms of even how to relieve stress and the stigma associated with stigma. All that we deal with so many issues, and we discuss with them at a friendly basis than a patient to a doctor patient. So after that is when I was appointed to this position as the County Director of Medical Services, whereby now I oversee all the hospitals in the whole county in matters of healthcare service delivery. And I've been this position since 2020, December, up to date. And at this position, I've been able to engage with community in various projects, working closely with the community health volunteers, working closely with key population like the women, the children, the youth, people with also non-communicable disease, and also as well as the elderly, and specifically as well as the pregnant women, which is one of the key matters that I had applied to Australian wards. That is one of the projects that I'll come to do when I come back to the county. And we've been able to ensure, as one of the person who's been spearheading, that there is privacy in attending, especially to pregnant women with disability at our county, as well as we have some of our staff who've done languages, speech languages, to ensure, even as well as caring for person with disability during delivery. We actually now have a team in place that is actually is caring for this mother in a special and specific way. They say, to whom much is given, much is expected. When I was in Australia, since I'd been sponsored to pursue this, the master degree in public health, which is such a privilege and a honor for me to be selected to pursue that degree, I involved myself in so many volunteering activities and community engagement programs. One I did was for breast cancer. I was working closely with the refugee as well as the elderly and marginalized group, and even the Aboriginal. And I got the experience of working with diverse groups of people from different culture, and I learned a lot in terms of interacting with them. Even when I came back to Kenya, to my country, in the county where it had also released me, it was so easy for me to be able to work with the community. And even with that, I was lucky to be awarded the community engagement grant from the University of Melbourne, where I was awarded $5,000 to come work with the youth and children in Machakos County. And I came back to the county, whereby I did a project on sexual reproductive health, especially for the youth and the youth and the adolescents. And we did a program on health education through a soccer game, whereby the youth would play tournaments, and after playing, we did the health education, and after that, we selected and appointed the youth champions to champion on the reproductive health in the county. And even that was the born of the youth center. The youth center in Machakos, whereby we offer youth-friendly services to our youth on matters of sexual and reproductive health. So I'm happy about that achievement, because I was sponsored by University of Melbourne, and it is because of engaging in several volunteering groups and projects in Australia, and I'm still continuing with the same in our county, whereby we've also additionally added the support groups through the cancer patient as well as the community volunteer. And through that, we've been able to work well and to build a good relationship with my colleagues. Some are colleagues, some have become sisters, some have become brothers, and some have become family because of the good relationship that I have created with my colleague. As much as I'm the director medical services, I always say I have an open door policy, whereby anybody can walk into my office anytime, where we sit together as a team and we come together with solution. And even if there is no solution, but we come together with a way forward, how we can work together. I've been empowering my junior colleagues, and even the ones that I supervise, to be able, and I've empowered them to be able that we can come to me anytime, and we tackle the issues or the different challenges that we go through as a county. And also, even with my supervisor, we have a good working relationship where we sit together and discuss, and they empower us as well. I'm also empowered with my supervisor to be able to discharge my duties appropriately and effectively. One of the ways that I learned to relax is spending time with my family. My husband has been really supportive in holding my hand as the director of the county, and has been really supportive, even in somebody who who can offers me a shoulder to cry on, or even just comfort, or even discussing with me on how to deal with these issues. One of my hobbies is swimming and traveling and just going out in a garden and relaxing. Or you feel satisfaction is serving the community. Just putting a smile on that patient who has lost hope, on that mother, on that child, on that elderly person, or that person with a terminal disease. Just putting a smile on them is what gives me satisfaction and fulfillment. I go home back while smiling. I would like to thank God for giving me this opportunity and just giving me good health and be able to undertake my degree, completing in time, and also in this position. I would also would like to thank my family, especially my husband, for his utmost support, holding my hand throughout the course and even to this position. I would like to thank the county government for giving me that time and also giving me the support to release me to undertake the master's degree in Australia and coming back to the same county so that I'm able to discharge my duties and also to give back to the community. I would like to thank the Australia High Commissioner, Luke Williams, for coming to visit me at my workplace in Machakos County last year at the Cancer Center. It is such an honor and privilege to have such a senior delegate create time to come follow up the alumni to see what they are doing. That is very rare for so many scholarships, so I'm grateful for that opportunity. And lastly, I would like to thank the Australian Awards Africa government for awarding me this scholarship. If it were not for them, then today I would not be here. So I'm very grateful for sponsoring me and having faith in me and believing me that I can actually do this masters in a foreign country, and that opportunity, the support both financially, both psychologically, and both even socially, that I was able to undertake my master's degree with no interruption, and I came back to my country, and whereby now I'm able to give back to the community for the knowledge and skills that I've gained through my master's degree. Thank you.